Hello, everybody. My name is Rania Patrice. I'm the Interim Executive Director of March for Science, and I'm so excited to be here today to help unveil a series of conversations with Black leaders in STEM. This very exciting series is being led by our Organizing Director, Cody Hankerson. Hello, Cody. And not only because it's Black History Month, but because if this pandemic has reminded us of one thing, it's that the system isn't broken. It's actually working perfectly for those it was intended and designed to work for. And until we acknowledge and address the systemic racism and inequity in this country, we can't actually have real and lasting progress and change. And that includes in STEM. So the show is going to center around the Black community, and the successes, struggles, stories, and all of the things that go into being Black in STEM. And we're very, very excited to have this conversation. We hope that everybody will tune in and join us and just see this as a place to have very honest, transparent, and very real conversations. We hope that regardless of your race, that you'll learn something, you'll take something away, you'll continue to join us. And with that being said, I'm going to turn it over to our amazing host, Cody.
Thanks so much, Rania. I really appreciate it. Yeah, so like Rania said, my name's Cody Hankerson. I'm the Organizing Director for March for Science Action. And I'm really excited to be bringing you this series for a lot of different reasons. Not only because I actually majored in the STEM field, biology from Morningside College, go Stangs, but also because science advocates and scientists from all over the world have been making massive contributions. And in particular, scientists of color and scientists that are Black in particular have been making sacrifices and challenges and successes that sometimes go completely unnoticed. And so in order to not only fight stereotypes, but then to highlight the successes and the joys that come from the Black professional community, we're having the show. And I'm so excited that our first guest is a Black woman from Omaha. She is a nurse practitioner, Dr. Angela Felton-Coleman. And she'll be turning on her video here shortly.
Hello.
Hi, welcome in, Doctor. And is it okay if I call you Angela through the story?
Absolutely.
Perfect. And then just to hype you up a little bit, Dr. Angela Felton-Coleman is a nurse practitioner from Omaha, Nebraska, who earned her Bachelor's of Science in Nursing from Clarkson College, Master's of Nursing in Nursing Education from the College of St. Mary, her Postmaster's Family Nurse Practitioner Certificate from Clarkson College, and also graduated from the Johns Hopkins School of Nursing Executive Doctor of Nursing Practice Program. Say that 5 times fast. I couldn't even survive half of those things. But on top of being a medical professional, Dr. Coleman is also the Vice President of the Omaha chapter of the National Black Nurses Association and is a proud member of the Alpha Kappa Alpha Sorority Incorporated. So Dr. Coleman, thank you so much for being here. I really, really appreciate it.
Thank you for having me. Thank you for the invitation. I'm glad to be here.
Absolutely, especially with you being as busy throughout this pandemic as you have been. And I know I only have you for 30 minutes, and so I want to just dive in and ask you the obvious question of how did you decide to become a nurse practitioner, become a medical professional?
I've wanted to be a nurse since far back as I can remember. I specifically remember about 2nd grade. My grandmother was a CNA. Back in a time when, that was really, really rare. She was a divorced mom of 11. And I just remember her stories talking about the nurses. She always had such great esteem for the nurses. She never really talked about the doctors much. It was always about the nurses. And just watching her get dressed in her all white uniform, I knew I wanted to be a nurse. So it's always been that. And then it just was a natural progression just through the nursing field. I was a floor nurse, and then I did case management for a while, did research for a bit. And I was like, I want to get in on the other side of that and actually become a provider. So that's where I became a nurse practitioner.
Hey, that's awesome. It's crazy how much our parents can impact
Yes.
the way that we see the world. My dad is a PA in Orlando, so it's interesting to see. But what was it like going through all that schooling that you had to go through? I mean, your resume is longer than anything. It's crazy. It's a book, you know, in and of itself.
Oh my goodness, that was boy, it was rough. I actually was a non-traditional student. I
Really?
went to school after marriage. I had 4 kids when I went back. My youngest was 2. So I started basically started undergrad in 2002 and just really haven't stopped ever since. It's been a struggle,
Yeah.
especially being Black, being, you know, there's not many of us in the field. So,
Right.
you know, there being one of the only 1 or 2 in class, dealing with just that in and of itself was difficult. But I mean, I have a great support system. I'm still in school, as a matter of fact. So it hasn't stopped yet.
That's amazing. And you're right. I think that a lot of us can come into this situation where we're the only, not only people of color in class, but specifically the only Black people in class. And one of the things I always noticed, I was just like, when I got into some of these classrooms and I was like or it was one other person, we ended up like sitting next to each other. If there was another Black person in class, we'd be like, hey, what's going on? We'll just sit here, we'll stay together. You like, you know?
Yes, it was my health assessment class. There were 2 of us in class, and we were going over the how to take care of a patient, basically the CNA portion of it. And our instructor actually called us to the front of the class and said, "So, can you tell the rest of the class how do Black people wash their hair?"
Oh no! Oh no! Oh.
My answer was, "Well, wash, rinse, repeat."
Yeah, it's like, how do you wash your hair?
Right. How do you wash your hair? It's like
I
that's
feel like, yeah, I feel like that's like a part of the difficulty of being Black, of people thinking that, one, you're the ambassador, but then like knowing that you're about to field questions for the rest of your professional career, probably about the Black experience, and like having to do this like education while you're trying to get an education and while you're trying to be a professional. it mm, yeah, I can't even imagine that. And then it reminds me, I was talking to this group of students last week. They're graduate students, and we were in this meet and greet for Black professionals. And whenever we started talking about that sense of like belonging that you get while you're in the classroom, of being like, you know, I'm here. Whenever I asked about imposter syndrome, and for those of you who don't know imposter syndrome, like Harvard Business Review defines it as a collection of feelings of inadequacy that persists despite evident success. So if you're in graduate school, you didn't fall there. You didn't just like come there by accident. It's difficult work. But when I asked who here has suffered from imposter syndrome, all of them raised their hand. You know, and so I was wondering, have you ever dealt with that? I mean, you're more educated than like most Americans, most other people in the world, and have had all these successes. Did you ever deal with that kind of imposter syndrome?
Yes, and I'm actually dealing with it now. It's amazing that you ask me that. I'm currently in an executive master's in healthcare leadership with Brown University, and we just started classes about 2 weeks ago, and that came up in class because it's like, you know, I'm looking at everyone else's resume, and it's like, oh my gosh, how am I even here? Why am I here? Am I supposed to be here? And you know, we had a whole conversation in class actually about that, and I wasn't the only one feeling that way, but I deal with that all the time. But my sister actually was like, you know, you didn't get invited here on accident.
Right.
You're supposed to be here. You were invited, so take your seat at the table. Be there.
Yeah, I'm sure they got to like your 4th degree and they were like, all right, yeah, I think this is probably an applicant for us. What kind of advice would you give to somebody who's in that situation, who maybe is coming into like their grad school program or to a new professional environment? Because it can be I feel like it can be very intimidating in that like you feel like you're the representative, like you're gonna speak for all Black people. Like if you're late, then like everybody just thinks, you know, like, oh, that, okay, guess, you know. So advice would you give to somebody who's not only dealing with the imposter syndrome, but that kind of burden of thinking that you're representing the entire like race?
I don't think that feeling ever goes away. But what I would say to that is, again, it like my sister told me, you were invited because of what you know, because of what you bring to the table. So if you were invited there, you deserve to be there, and you're supposed to be there. So bring your knowledge, bring what you know, do your thing.
Own it. Yeah, that's awesome. I guess one of the questions I also had from just looking at your resume and looking at your background, and actually the way I found you, was your sorority helpful in trying to and kind of bringing you that sense of like not only like sisterhood but belonging into like a greater community?
Absolutely. My sorority sister is the vice president of the United States of America.
That's awesome.
Yeah.
I didn't know that. I didn't know that.
Yes. I actually got to meet her when she was actually on the campaign trail, when she was running for president. So I have this wonderful picture with her, and I look at that, and I actually had a friend send me a message on Facebook. She's like, do you realize you have a picture with the vice president of the United States? Yes. And she's my sorority sister. So just having that sense of community and knowing that, I have sisters all over the world. And it's my biological sister who told me take your seat at the table, but I have sisters all over the world who are taking seats at all the tables, at one of the highest tables in the world. That support is phenomenal.
Yeah, and I think that really is important to be able to not only see that you belong and to talk to other professionals and to other just Black people in general about your experiences day over day. I know that was really important for me in political organizing. But then like sometimes you just need to vent. Like you just need to be like, so let me tell you what happened at this gathering, and I was the only person to catch it. And you start to kind of think that you're crazy, and that you're like, man, am I being like overly sensitive about this, or am I in the wrong? Has that ever been something that you had to wrestle with, where you're in a professional environment and you're like you're one of the few, if not the only Black person there, especially Black woman there, that you're dealing with not only the unconscious sometimes stereotypes or racism that exists in a workplace, but also the sexism that exists over a workplace, where something there, I can imagine the duality of those two. What have you ever had to deal with that?
Absolutely. Deal with it every day. I am the only Black person who works in the emergency department. I mean, just imagine that for a moment. As a family member, you come in, I'm it. We have a doctor there who's Nigerian, but he, that's a little different.
Right.
And when families see me, especially Black families, I've had kids call me Doc McStuffins, which I think that's the sweetest thing ever. They're excited to see me. The families are excited to see me because they see someone who looks like them, who can understand what they deal with on a daily basis. But then the flip side of that, as you were saying, there's the sexism part of it. I go in the room, I do my assessment, I come up with a treatment plan. You're taken care of. And then I get the question, so when's the doctor coming in? I am the doctor.
Yeah, like, so hi.
Yes, again, I am the doctor, but dealt with that, as a nurse on the floor as well. You go through your whole thing, and they look at me and, are you going to take my trash out? Are you here to change my bed? It's, we deal with that daily.
Yeah. How do you process that? Like, how do you just go from, because in that moment, because I've been in similar moments, and how do you kind of process in that moment? Because sometimes what I've done is just like kind of freeze and thought, did they just say that to me? I'm crazy. And then like process it and be like, oh, they did say that. And then you gotta kind of like compartmentalize it in that moment, because you're like, I'm a professional. I can handle this. Should I freak out? Should I use this as an education moment? What's kind of your thought process from the moment that happens into, because I feel like that's an ongoing battle.
It's an absolutely ongoing battle. There was actually an instance. There was a nurse who it was a group of nurses. They were going through and kind of repeating things that family members had said of different patients. And one of them, they started talking Black, so to speak. Yeah. And before I could stop myself, I turned around and said, I need you to use your white person voice. And, it was just like, well, should I not have said that? But then again, they shouldn't have been saying, what they were saying. So it's a lot of tongue biting. But at the same time, I'm quick to correct. I'm very quick to correct. If it's something that, I'll pull someone aside. I don't want to embarrass anybody by any means, but if I feel something needs to be addressed, I absolutely will address it, because who else is going to?
Right. Yeah. I guess the last question I had before we transition into more of what you're dealing with right now in your job is that whether or not like people Black people in powerful positions want to be, you just by proxy become a role model. You become a goal to be achieved for a lot of the people who maybe we weren't able to bring with us on like a journey, or bring with you in your journey up into a high power career. What advice would you give to specifically to Black girls and Black girls who are teens, and even in Black, just people in general that would want to get into the medical field, would see you and they're like, yeah, that's what I want. Like, that's who I want to be.
I tell them, do it. I mean, I as much as I can, I like to talk to the kids in the community. Thanks to the pandemic, we haven't really been able to do that as much. But that's one of the things that Omaha chapter of the Black Nurses Association, that's what we like to do. We want to go out to the schools and talk to the kids. Where are our Black girls and boys who want to be nurses, who want to be doctors, who want to be researchers? You got to be the change that you want to see. So, if I can be out there, if I got to be a role model, so be it. I'm that person. I'm happy to talk to anybody. I get messages, I get inboxes, can you help me with this? I have a question about that. I'm happy to answer anyone's questions. If I can be here and do this, anybody can be here and do this.
No, you're doing the Lord's work. It's hard. It's hard to have somebody like look up to you even when you don't necessarily want it. You want to flip the switch and be like, I just need to be like speak however I want to speak in this moment. But yeah, that can be a challenge for sure.
Yes.
Because this show is going to be centered on the Black community and the struggles there within, a lot of the questions I'll have and in particular will be of your experience dealing with either the Black community in Omaha, or just your experience dealing with Black patients, or just your experience kind of interacting with other groups. I know Omaha is a much bigger city. I'm over here in Sioux City, but just your experience in general. So with that said, in your view, what are the current health challenges the Black community is facing in regard to COVID-19? I know that this is a big question, but I think we've seen in the news over and over again that COVID-19 has disproportionately impacted the Black community. So what would be some of your thoughts on that?
Well, it's nothing genetic. A lot of people think it must be genes. It's nothing genetic. It's more environmental, education. It's what we eat. It's how we live. There is some things that are not easy to change.
Right.
A lot of it's discrimination. Do we have access to good health care? Do we trust our healthcare providers? If we don't see someone who looks like us, do we trust those people? That's really, really hard. Our occupations, the jobs that we work, our jobs putting us, in close proximity to people who have COVID. It's just all those things. But I think a lot of it is the underlying health conditions.
Yeah, it's all the things that were there already, just kind of this being the straw that broke the camel's back. And not only that, now it's just exacerbating it to a high degree.
Yes.
No, that's interesting. And then why do you, another thing that I've been seeing is article after article talking about hesitancy to get vaccinated. So specifically within the Black community, but we know the history that the Black community in particular has had with a lot of the scientific community, and with things like not only the Tuskegee experiments, but a whole litany of just scientific experimentation that has been done on the Black community. It's just horrific, right? And so not only on top of that healthcare aspects, why do you think that there might be that hesitancy to get vaccinated, as well as how not only healthcare professionals, but also just people in general can help encourage the vaccination process?
I think it all boils down to distrust. And it stems from, like you were saying, the Tuskegee experiment, the US government experiments with radiation, experiments on prisoners. gynecology, just the whole study of gynecology, you know, built on Black women's backs.
Mhm.
So we have to get past that distrust.
Yeah.
And again, as you were saying, the way you would do that, we need more people who look like us,
Yeah.
that are taking care of us.
Mhm.
My grandmother's a prime example. She didn't believe anything her doctor had to say. But once, you know, I was able to talk to her a little bit about some things. You know, this was years ago, and hearing it from me
Mhm.
makes a huge difference. If I had $1 for every person who messaged me, said, should I get this vaccine? I could be retired right now.
Yeah, I bet. Yeah. And I
But
feel like that peer-to-peer, that, yeah, like you were saying, that peer-to-peer, there's no substitute for it. That community organizing aspect of like, hey, so what have you heard?
yes, what do you think? Which one are you going to get? Are you going to get it? And you know, at first I was like, you know, that's a personal decision. You have to talk to your doctor about that. And then, you know, that switch flipped, excuse me. And it's like, you know, they're coming to me for a reason. They trust my opinion. They trust what I have to say. So I'm just going to give it to you straight. You know, I got my first Moderna, and I did the Moderna versus the Pfizer after doing my own research. You know, maybe I can make heads or tails of it a little bit better than someone else, but, you know, I had to make the decision for myself.
Mhm.
And so that's what I did.
And I've also heard that a lot of it is based off of word of mouth, honestly, is being like, oh yeah, appointments are available here, or like, here's the website that you can go to. One of the things that I was talking about to the person who actually came up with the idea for the show, Clayton, we were saying like, I don't know, at this point, who would people like trust more? Would they trust like a talk show host, or would they trust like Dr. Fauci that's in like the White House, you know? And it's just like, well, which person do they feel like is being more honest with them, you know, or which person do they feel like has less of an agenda? And yeah, I think a huge part of the marriage that has to happen, and hopefully a future guest that we'll have on as well is like that is a SciComm, a science communicator that I have no idea that entire field existed, where it was just their whole job is to communicate, be like, all right, you've done so many years of school, break that down to 30 seconds. You know, I was just like, well, bless them for it, but you know, it's crazy. And then I guess if you were in front of your sorority sister, if you're in front of like Vice President Harris, what would you give her for advice to, as far as politicians or local officials, even to how they can communicate that this vaccine is necessary and that it's good for not only their communities and their immediate households, but just for the country at large? What kind of advice, I guess, would you give from a medical perspective?
I think they need to be transparent and talk about the safety, how is it effective, and side effects. I think that's a lot of people's big concern is, you know, what are the side effects? So be open, be honest, tell the people if somebody asks you a question, give them a direct answer.
Yeah. Yeah. I mean, that's 9/10 of I feel like that's like 9/10 of the battle is.
People think they're being lied to. And it's like they, you know, feel like the vaccine was rushed. Why is the vaccine being rushed out? You know, they're trying to put microchips in us. You know,
Yeah.
I've heard some crazy things. And it's like, you know, stay away from the 5G tower after you get your vaccine. It's absolutely nuts. But I think if people can just get the truth in terms that they understand, you know, don't talk to people like they're crazy. Don't talk to people like they're children.
Yeah.
Just give them the information that they ask for and be as open and honest as possible.
Yeah. Meet people where they're at.
Yes.
And the last question I had for you before I let you go, and also for everybody who's in this live stream, thank you so much for tuning in. We're also going to be putting the CDC guidelines, the official CDC guidelines, into this comment box on Facebook. So that way you can always resource that. That's the best website that you can go to get COVID-19 related information, as well as talking to medical providers like Dr. Felton-Coleman. But the last question I had for you, Dr. Felton-Coleman, was just what have you been seeing, or what is the number one thing that you've been dealing with as far as being a Black professional in a field that you're very visible, and not only in your community work, but on like social media? What advice, I guess, on top of that, would you give to people who are coming into this sphere where you're a pioneer, you know, of there's not very many people who are in your position, not very many Black women who have achieved what you have achieved. What advice would you give to dealing with I guess the pressure also that I can imagine would come to that kind of role?
You have to push through.
Mm.
You absolutely have to push through. I mean, it's, you know, like I said, I was a non-traditional student with 4 kids and a husband in a household and work. You just have to do it. And I mean, do it not just for yourself, but do it for your community, do it for your family. You know, again, you know, I refer to my grandmother all the time, and she's the reason I'm here.
Mm-hmm.
People are counting on us.
Yeah.
And they need to see people who look like us taking care of them.
Mm-hmm.
I mean, not to say that you can't trust any other healthcare professional, but I feel like we need to see more people who look like us. And that's actually my project that I'm doing for Brown, is to try to increase diversity in my workplace, because we need more people who look like us. So our people are more comfortable seeking out health care, so they don't end up with, you know, all of these disparities.
Mm-hmm. No, well, I am so appreciative that you came onto our show and that you've been able to bring us all the information. And thank you also for being open about your experience. I know it's not easy to speak about things that can make us feel especially vulnerable in a professional way, but especially to do that in front of an audience is really awesome.
Well, thank you so much for having me. I was glad to be here.
Absolutely. And thank you so much to everybody again in the chat box. And across all of our different streams, we have an audience of over 1 million. And I'm so excited that each of you have taken a little bit of time out of your Wednesday to come and learn something new. If you have any recommendations for people who should come onto the show, or if you are a leader of a nonprofit, or if you're part of another sorority like Alpha Kappa Alpha, or part of the Black Nurses Association, please do reach out to us at March for Science. You can reach us through Twitter, Facebook, Instagram, whatever. We'll respond, and we would love to have you on this show. So again, thank you so much, Dr. Felton-Coleman. I really, really appreciate it. And thanks to everybody out there.